Christina, there comes a time when living at home can become difficult for a person with LGS and difficult for both the parents and the caregivers. But there are options. Can we discuss a little bit about assisted living and group living opportunities?
Sure. So assisted living and group residential facilities are available to individuals with disabilities. And it may not be something that parents want to think about early on, but they should. These different facilities and programs differ from state to state. Some are funded by state or federal funds. Others are privately owned and funded privately. So it's important to do a lot of research to find out which type of facility you would be most comfortable with.
Can you just touch a little bit on the difference between assisted living and group living opportunities?
Sure. So assisted living is an option for some individuals who basically have assistance where they live. It may be an apartment, they may have a roommate, they may have a caregiver of some sort come into that type of environment to make sure that they're taking their medicine and have the appropriate food and are being looked after, so to speak. Group facilities are more like homes where people with multiple different types of disabilities, not necessarily just epilepsy, live together in an environment where there's 24-hour staff and they're being watched over, their medical needs are being taken care of. So that's the difference between the two.
So Dr. Roach, regarding long-term planning in a general sense, when should assisted or group living be considered?
I think it depends on the individual. Relatively high-functioning individuals typically are able to stay at home longer. Some families have sufficient resources and abilities that they can manage to keep the child home, even into adulthood. Mm-hmm. You have to individualize, and I would agree though with Christina that it's good to think these things through early, because a lot of the families have a huge emotional crisis and just surrounding this whole question, and it's a good idea to go ahead and think this through so that you've dealt with some of those issues really before you're there.
So that's one emotional challenge for the family. The other is to think about the future for their child. They have to realize the limitations of the child in a lot of cases. They have to think about residential options for the future. And a lot of parents do not want to think about putting their child in a residential facility in years to come when their child is still, well, a child. There are a lot of emotional burdens that kind of revolve around this transitioning phase. And I think it's important for parents to understand what those could be so that they're better prepared for the future. But I also think that perhaps we should ask the people with LGS what they think about moving into an assisted living or group home, because sometimes they want their independence. And I think a lot of time what we tend to do as caregivers is say, I want to make sure that you have the best environment and I want to protect you and I want to care for you. But to a level they are independent and can, take care of themselves to an extent in a lot of cases. Not true for all patients, of course, but it's something to consider that they have needs as well. They may want their independence. They may want to move out of mom and dad's house.
So Sam, what are your feelings or thoughts about moving DeMarcus into one of these facilities?
Very concerned, just as Dr. Roach was saying, as being a parent, you have that tendency to hold on to your child. Mm-hmm. But I think if you communicate that with the child, you can help gradually move that child into the adult facility that they feel comfortable with, as well as you as a parent feel comfortable with. So.
For my brother, he actually still lives at home with my parents, but he attends a day program for adults with disabilities. And it's just a fabulous program that we're very, very fortunate to have. For other individuals, they may be more independent and can live in an assisted facility. And they're able to, take care of themselves on a daily basis, but do need some extra help coming in to make sure they're taking their medication, right. Things like that. In a group facility, it may be great for individuals to wind up going there because there's social interaction, there's other individuals with similar needs and disabilities. So it really does depend. I think it should take it on an individual basis.
And doctor, this is for you. Do you see benefits for the people with LGS or children with LGS being among new people and new experiences?
I've seen it I've seen it go both ways. Certain children don't deal well with change. They don't deal well with being overly stimulated, and taking that child out into a crowd, things like that, they don't deal with that well. On the other hand, there's a danger that having epilepsy, you see people who are socially isolated because of that. But in general, I encourage people to send their child to school, not homeschool. A group home, I think, is a good idea.